Hello and welcome to prostatevideos.com. I'm Dr. Gerald Chodak. In this video, I want to talk about an overview of managing clinically localized prostate cancer. The choices have expanded such that there are now 14 different options that men have when they're diagnosed with this disease. And unfortunately, we don't have good studies that have compared surgery to radiation or to most of the other treatments. Another weakness is that we don't have long-term follow-up on some of the newer treatments. For prostate cancer, it's important to know what happens in terms of survival at 10 years or even 15 years. Knowing what happens to the PSA level at 3 to 5 years is just not enough information to be able to evaluate whether a treatment is all that good or not. So as you watch the other videos that talk about each of the options available, keep several things in mind. First of all, when you go for counseling to a doctor, make sure that your doctor is giving you all the options that are reasonable for your age, your health, and your type of tumor. Also be aware that the treatments that might be good for a low-risk prostate cancer may not be the same as those for a high-risk prostate cancer. So knowing your Gleason score, being aware of it, being aware of the PSA and the clinical stage is important as you work through what might be the best or right treatment for you. Another thing to consider is that if you're going to consult with a specialist, you want to know how good that specialist is. You want to know how much experience they have. Certainly we know that for surgery this is extremely important, but it's also important for other treatments. Some of the newer treatments, people need to have good experience knowing how to administer the therapy. So as you go through the various options, be aware that we can't tell you for sure that one treatment is clearly better than another treatment. The only comparison we have is one study looked at surgery or watchful waiting. But in terms of cryosurgery, radical prostatectomy, radiation, brachytherapy, high-intensity focused ultrasound, proton therapy, we just cannot tell you yet whether one is clearly better. And so the best message to leave you with is that you should make a list of all the advantages and disadvantages of each of the options. Another thing you want to find out as you're getting information is what are the odds of getting side effects or complications. And those can be obtained from written, validated questionnaires, or they can be estimated by the doctor that's taking care of patients. Much more reliable results are obtained when written surveys are used. So another question to ask when you speak to your doctor is, what are the odds that I will get a complication at my age and at my health? And how was that information obtained? Was it obtained by using the written surveys? Was it obtained from studies that have been published by experts from around the country? And also, you want to know whether the results reflect the doctor who's going to take care of you. It really doesn't matter what's happening to a doctor at some famous institution, because that doctor may not be giving you your care. You need to know, or should know, the odds that you're going to get a good and bad result with the doctor you are consulting with. An analogy that I've made before is, think of this as playing blind poker. That's a game in which you're dealt some cards and asked to make a bet without knowing what the cards are. You can't see the cards. You're playing blind. In many ways, patients are told what can happen, but they're not told the odds that a good result or a bad result might occur. And so they're being asked to make a decision about their health and about their quality of life without having all the information. Some men might avoid a treatment when it has a 5% chance of causing a side effect, and other men might be willing to accept a 15 or 20% chance of a side effect and still accept that therapy. Every man will individualize these decisions, and it's important that you make a decision that fits for your age, for your health, for your quality of life, and the type of tumor you have. I hope you find this information useful. Thank you.